This video is all about Parkinson's disease. After watching this video, participants will be able to describe what Parkinson's disease is and recognize the different symptoms that people with Parkinson's disease have. They will also be able to explain different types of treatment that people use to help with this disease. Parkinson's disease happens when nerve cells in your brain break down or even die. This happens in a tiny part of the brain called the substantia nigra. When these cells are damaged, the brain loses something called dopamine, which is a chemical in your brain that helps the body with movement, memory, and pleasure. When there is less dopamine, it causes abnormal brain activity, which leads to the many different symptoms of Parkinson's, which will be illustrated in the next section. The cause for Parkinson's disease has not been confirmed. However, Parkinson's disease is said to stem from several factors. These factors include genetics, Lewy bodies, loss of dopamine, environmental toxins, and age. Genetics. The Mayo Clinic reports that someone with a close relative who has Parkinson's is at an increased risk of developing the disease. Lewy bodies. Lewy bodies are protein clumps in the brain that inhibit the functions of the brain. These clumps are more prevalent in those who have Parkinson's disease. Loss of dopamine. Dopamine is a neurotransmitter that aids in sending messages in the brain. It is found that dopamine-producing cells in the brain are disrupted in those with Parkinson's disease. Environmental toxins. Pesticides and herbicides have been associated with having an effect on the onset of Parkinson's. Age. Age has the biggest association with Parkinson's disease. The disease is seen to affect our population more as we continue to age. The culmination of these factors is said to contribute to the symptoms seen in Parkinson's. The symptoms of Parkinson's disease can look differently on every person with this diagnosis. However, here are some common signs that you may see. As we go through each one, notice how each change becomes smaller. This becomes important for treatment and making the individual feel more comfortable throughout life. One thing that you may notice about someone with Parkinson's disease is that their arms and hands seem to shake a lot, whether they mean to or not. This shakiness is known as a tremor. You may also notice them swaying back and forth as well. These tremors are one of the most noticeable symptoms of the disease. The movements of a person with Parkinson's will become a lot slower and smaller. You may notice this symptom most in the way the person walks, as they take shorter steps and shuffle their feet. This change can be a result of muscle stiffness throughout the body. This also will have an effect on a person's posture as well. It becomes smaller and stooped forward, which does not allow for much balance or coordination. Falling becomes a serious issue with this symptom. The way a person with Parkinson's communicates with others will also be different. Across the world, people use facial expressions as a way of showing an emotion. For example, you smile when you are happy. For those with this disease, these facial expressions become harder to do as the muscles within the face grow stiff. It is common for these individuals to have a blank expression, even if they were feeling happy. This blank expression can also be seen when these individuals speak. Their voice becomes quieter with a constant pitch, and they may have trouble forming words and making sense of conversations. Even further, a person may attempt to write out what they are trying to say and still have difficulty. Handwriting can become jumbled and hard to read. As time goes on, a few more changes take place within a person's daily life. Memory may decrease. Their sense of smell may not work well. They might have difficulty swallowing food or liquids, have trouble sleeping, and they may become sad or depressed. Unfortunately, Parkinson's is a disease that cannot be treated and gets worse over time. However, there are medications that can help control the symptoms. These patients can consult with their doctor on their symptoms to help pick the right medication for them, because often symptoms are different from person to person. In addition, there are ways to help control symptoms. A healthy diet can ensure that medicine is working effectively and can provide more energy to the patient. An exercise program that includes cardio and strength training and flexibility is also helpful. Yoga can improve the balance of these patients, and massage can help control pain and stress. Finally, physical, occupational, and speech therapists work as a team to provide the well-being of this patient. Physical therapy can help with things such as balance and stretching of their muscles. Occupational therapy is there to make sure that the patient can do their everyday activities despite their condition. This usually means that these therapists have to modify how they do their tasks and what they use. These activities could include learning how to dress themselves, make meals, or even get out of bed. And finally, if speech therapy is needed, they would work on speech problems and communication. All of these treatments should be used together to provide the best care for individuals with Parkinson's.